Hello, I'm Lisa Ringenberg, a DNP student from Brandman University. I will be presenting to you my innovative project proposal regarding smartphone applications for the improved diabetes compliance. Center for Disease Control, CDC, stated in a statistical report from 2018 that 34.2 billion people have diabetes in the United States. Of those, 7.2 million are undiagnosed. The ability to engage those diagnosed patients with smartphone applications will assist in improving compliance and will improve diabetic patients' overall health and longevity. The geographic location in which I function as a provider has a high population of Native Americans, which have increased incidence of diabetes. The area also has a large landmass in which it makes it difficult for those patients to travel distances to see their providers. The internet and electronics capabilities compared to the rest of the U.S. were very limited in the Southwest. In 2000, President Bill Clinton visited the Navajo Nation for the purpose of evaluating cellular and internet technology. It was determined the local area was in great need of upgraded technology services, and those services were then provided by the U.S. government. For the first time in history, the remote area now had access to the rest of the digital world. Native Americans not only experienced improved internet access, but also up-to-date technology. The government also ensured each Native American over the age of 18 was given a cellular phone. Digital technology has not only improved communication, but improved medical care to the region. The opportunity for immediate access to providers and improved compliance was within reach. Mobile applications and telemedicine were now possible. Smartphone applications can now have an impact on improved compliance, health, and patient outcomes. MySugr smartphone application can improve diabetes by monitoring blood glucose levels and auto-syncing with their finger stick blood sugar devices, simple nutrition and carbohydrate intake and counting, medication reminders, exercise tracking, provider follow-up, and reporting capabilities. This can improve a hemoglobin A1C by targeting a range between 6 and 7%. Cultural barriers make compliance very difficult. Smartphone applications such as MySugr can assist in compliance. CDC reports that diabetes is the 7th leading cause of death in the United States. $327 billion was spent on diabetes in 2017. A statistical report in 2014 regarding national diabetes, the CDC reported diabetes can affect heart disease, stroke, blindness, kidney failure, and lower limb amputations, among other conditions. The CDC also estimated 7.2 million hospital discharges were diagnosed with diabetes in patients 18 and older. ER visits with diabetic complications totaled over 14.2 million. Type 2 diabetes has a direct correlation with increased body mass index. In a fact sheet by the CDC in 2017, reported 2 out of 3 Native Americans have kidney failure due to diabetes. National Institute of Health states that Indian Health Services was created by the U.S. government on July 1, 1955, and control changed from the Bureau of Indian Affairs to Public Health Service to improve health care to the Native American population. Construction of hospitals and clinics throughout the nation began in 1961. Unfortunately, due to the geographic size of the Navajo Nation, travel to these facilities still remained difficult, which resulted in missed provider visits, decreased use of medication use due to inability to obtain those medications, and decreased knowledge of appropriate nutritional intake. The implementation of a smartphone-based application can have a huge impact on compliance, improved health, and long-term improved outcomes. It would decrease incidence for need to travel, bring improved knowledge of diabetes, and improve ability to track logs for finger stick glucose, nutrition, and shared reports for providers. The collaborators I chose to interview were 3 very significant stakeholders in diabetes management: a nurse practitioner that provides care for many diabetic patients, a diabetic nurse educator at the local hospital, and a diabetic patient. All 3 interviewees intersect during diabetic management. Each interviewee was asked 5 questions. The first 3 were identical questions, and the last 2 were specific to their role with diabetes. The questions that were posted to each interviewee are summarized in the next slide. The interviews were conducted by 2 telephone interviews and 1 face-to-face interview. The interview with the nurse practitioner yielded the least interesting perspective. She agreed there were issues with compliance from patients and a significant distance for some of her patients to travel to her location, but seemed the most interested in obtaining the auto-lag stats from the application. She questioned whether elderly would be able to grasp the technology and how to engage and auto-sync the AccuCheck and other fingerstick devices. I explained there would be initial instructions required to get some of the baby boomers up to a level of understanding and consistency, but after they mastered it, time and ease would be significant for them. The benefit for her was the ability to monitor and adjust treatment for them in an improved manner. The hospital nurse educator had some very good contributions to offer. She had never been involved with a patient that had used a smartphone application such as MySugr, but agreed it may prove to be very helpful, especially in type 1 younger adults that was techno-savvy and type 2 adults. She was most interested in the ability to track the hemoglobin A1C from the AccuCheck trending as well as the medication reminders for her patients. Her most curious questions were about the ability to take pictures of the patient's diet intake and converting it to carbohydrate counting. She agreed that particular aspect would make her job much easier. The patient interview had the greatest impact. She was a type 2 diabetic and was currently frustrated with carb counting and logging her blood sugars. She was unaware that smartphone applications such as MySugr even existed. She agreed that the auto-sync blood sugar logs and carb counting was a fantastic idea. She was willing to try a smartphone application, and the information to access those were provided. She currently uses an online portal to log and access her blood glucose logs and carb counting. The application would not only save her time, but be much more convenient as an application on her phone. The carb counting portion of the application was the most important to her. Her view currently is that carb counting is difficult for her, and the ability to just take a picture and have it calculated would be a huge positive. MySugr application will directly impact improved diabetes compliance in this population. MySugr application was developed in 2012 by Frank Wasserman, Frederick DeBong, Gerald Stengel, and Michael Forsyth in Vienna, Austria. MySugr is available in 13 languages, is a registered risk class 1 medical device in the US and Europe. If utilized properly, it can not only log blood sugar levels, but will pair with any AccuCheck as well as many other devices, syncing the values automatically to MySugr application. It was designed for type 1, type 2, and gestational diabetes. The application has the ability to track medications, including reminders, insulin levels, carbohydrate intake. Diet log allows you to simply take a picture of your intake and it will calculate the carbs for you. Activity logs and basal rates. If logged consistently, it has the ability to calculate a hemoglobin A1C over a 90-day period. It has real-time global positioning, so the activity is logged at the exact location where you are currently located, which would mean an example of type 1 diabetic young man participating in a cold weather activity would need increased caloric intake. It can calculate that for you. All of the information can be replaced in a report and encrypted electronically and sent to their providers. I'm now aware firsthand of how Johannesson, 2006, viewed the importance of intersections of ideas. Combining the views of provider, educator, and patient allows for that intersection of usable ideas in diabetes management. MySugr application is a great example of an introduction in creating an environment of change and approaching healthcare from a different perspective. Christensen, Grossman, and Huang, 2009, describe how to be innovative by reducing costs and improving quality and accessibility of care. MySugr application addresses all those issues. There is a potential for reduced costs to the patients for travel, time away from work, and home. The quality of information going to the provider is much more accurate with the auto-syncing of the glucose monitoring units and utilizing the reporting capability directly to the provider. This not only allows for accuracy but also affects the quality of consistency of care given by the provider to the patient for improved compliance, which improves the patient's quality of life and life expectancy. The interviews all supported interest in the smartphone application of MySugr for different reasons. McGuire 2007 states that the implementation of mobility can have a direct impact on technology and improve our business practices. There were many articles found in support of implementation of smartphone applications to improve patient care. I interact daily with diabetic patients. This is an opportunity to implement an innovative change project. Thank you for your time. This is the list of references that I used to support this presentation. Thanks again.